So hi everyone, this is a review of the presentation that we had at our Teapioca Social on August 1st. This is just a little bit of history about Manos Juntas and the direction that we're wanting to go. So, first of all, a little history. The clinic was founded by Dr. Shook, which most of you know, and actually his daughter. At that time, she was Reverend at Epworth United Methodist Church. What happened was that they went to Nicaragua together, and they were moved by the need down there, and they thought about what they saw at home, and they realized that there was a great need in Oklahoma City as well. So they opened up a free clinic at Epworth United Methodist Church. Now, the mission of Manos Juntas Foundation is to join hands and work together to break the cycle of poverty through healthcare and education. And this is healthcare and education for both our patients and our students. Now, you'll know that a lot of the patients that come to Manos Juntas, they are uninsured, in between jobs, or they're basically good people who just need help. And as it is, all these blue dots that you see on this map are our patients, and we really are a community clinic. We are located basically around here, and sometimes we have patients who come in from Kansas, but that's very rare. So really, we're very proud to call ourselves a community clinic. Now, as you can see, the number of unique patients has been growing for the past however many years, and there really is a need in this community. And the majority of our patients will have hypertension, diabetes, and hyperlipidemia. And a lot of times they'll have multiple symptoms as well, or multiple diseases, I'm sorry. And so earlier I said that we had over 2,100 unique patients, but what that really means is that we had 6,300 clinic visits in 2011, and that means that the same patient could have come back more than once. So really what it was that we saw 6,304 people in about 52 days. So good job, volunteers, because honestly we wouldn't be able to do it without you guys. And so, speaking of you guys, our volunteers are really the heart of this clinic, is what Dr. Shook always says, and it really is true. We average 50 volunteers every Saturday, and for a lot of nonprofits, that's really unheard of. And so you'll see that the number of volunteers has been growing as well. I think last year we had 414, it was 420-ish, and we actually have on file over 1,200 volunteers. And so, as it is, volunteers are such a central part of this organization that we wanted to get you guys to become a little bit more involved in some of the other aspects of Manos Juntas. And so, recently, Tyler Schwartz, a third-year medical student who has been volunteering here for about 6 years now, I believe, we got together and we talked about how there needs to be a clinic volunteer coordinator and an office volunteer coordinator, because we're growing at such a rapid rate that more organization is required for our efficiency. And so most of you are very familiar with the clinic. We have pharmacy, triage, and laboratory. Those, we would say, are our main departments. But we also have some other things that we need to give more attention to. One is data entry. Anything that we collect, any blood pressure, height, weight, we put it into a computer system. And it's important that it's put in correctly, or else it's hard for us to research our patients and improve on what we're doing. Translation, donation, collection, education, and children's are some other things that need to be focused on as well. And you'll know that we're very convenient with very lenient with volunteers, and we try to make it as convenient for you guys as possible. But we're going to have to start scheduling some things, and one of those things would be translation. The majority of our patients are Hispanic, and a lot of them don't speak English. And so the job of the clinic volunteer coordinator would be to make sure that we have translators every single week. They would also be in charge of making sure that there's somebody manning the donation table. We have a laptop that everybody puts patient ID numbers in, and at that table is a donation jar. And we've noticed that on weeks that we have somebody actively asking for money, we get about triple the amount of money. It's basically the difference between $30 versus $100. And so that's something that's very important to us. And so this is something that the office, or the clinic volunteer coordinator will be in charge of as well. Education. So Dr. Crutcher, one of the doctors in the back, I remember talking to him, and he said that, you know, as a clinician, I don't have 30 minutes to sit down with a patient and talk to them about their eating habits or their exercise routine. But as volunteers, because we have so many volunteers, you guys do, and you have the basic knowledge necessary to sit down and have a one-on-one talk with our patients for that. And honestly, this is important because it extends past just giving them medication. It's looking into what they do during the week. And so this is basically a new opportunity for volunteers who are interested. And then the last part is children's. We started getting 2 pediatricians coming in, and so we would like to have a sort of a children's craft table or anything to keep them entertained or just kind of doing something, because you know that they wait for a couple hours and children get antsy. I mean, we would, and so the kids must be really bored. And that's something that we're offering as a new volunteering opportunity as well. And so this is something that we'll be focusing on in terms of the clinic. Now, the other side of it is the administrative side, what we do in the office. And this is the job that we're offering, is an office volunteer coordinator. And this person will look into donor cultivation, some administrative things, some fundraising, and some other special projects. So first, I'd like to talk to you about donor cultivation, and you'll see that with other nonprofits, they will expand their programs based on how many donors they have, because the more income that they have, the more they are able to do. But because we have Dr. Shook as our main benefactor for the last 16, 17 years, we've been able to expand so much, but now that we look back, we don't have a donor base to support us, so it's not very sustainable, because you know, Dr. Shook won't be around forever, and we all love him, but he can't keep doing this. We basically need more donors. And so, and the word cultivation is used is because it really does take a long time for people to learn about us and care about us. We're not out to get people's monies. We're out to kind of tell them what we're doing and get them interested, because we really are doing a good job and making a difference in the community. And if people know about us, then they'd be more willing to give. And so the other part of it is some administrative duties, because after clinic is done on Saturday, there are papers to be filed, there are medical records to be sent out, and these are things that can be done by volunteers. And I know that there are people out there who like to file papers. I don't know why, but there are people out there, and we just want you guys to know that these are opportunities that you can get involved in. The other part is grassroots fundraising. As a clinic, we do apply for grants, and we do ask donors for donations, but fundraising is the other part of it. Little things like car washes or yard sales, those things don't bring in a gajillion dollars, but they help, and it creates awareness in the community about us. And there are also some special projects going on, and I'll tell you about them. The office volunteer coordinator would be overlooking this as well. First, it's the Strong Neighborhoods Initiative. This is an initiative set forth by the City of Oklahoma City, and what they're wanting to do is develop areas of great poverty in the city. And we're in the middle of one of them, basically. And so what we'll be doing is going out into the community and conducting a survey, asking people who live in the community what their eating habits are, their health habits, exercise routine. You know, if we had Zumba classes, would they want to come? Is that something that they'd be interested in? That's one thing we're working on. Right now, we are having a documentary screening of The Weight of the Nation. It is a documentary put forth by HBO about obesity in America. And we're having it every Tuesday evening in August. and the screenings are at 7 p.m. So tell all your friends to come. It's going to be at the Epworth Church where we have clinic. The next thing that we'll be having is a diabetes-friendly dinner. You'll notice that the kitchen is almost done, and whenever we're done with that, we're going to have healthy cooking classes. And so to kind of advertise our new program, we'll be having a free event with foods that we cook from the kitchen that will be done by volunteers and patients. And it'll be a free dinner, but it'll be a fundraiser. So we'll tell people that come for dinner for free, but bring your checkbooks, and if we inspire you, then we encourage you to give. After that, in February, we're hoping to have a celebration gala, and this would be an event. I'm looking at a venue on the 36th floor of the Chase building downtown, and it's going to be $100 a plate. There will be a live auction and a silent auction. And the main purpose of this is really to fundraise for Manos Juntas. And this is something that's very involved, and we'll need a lot of help from the volunteers, from you guys basically, for looking up items so that we can get them donated, to inviting people, to being there on the day of, to be greeters and valet parking, or whatever it is. There's a lot of things to be done. And so that's another special project that's going on. So if you're interested, keep that in mind. And so let me go back to grassroots fundraising really quick. What is it? Grassroots fundraising is something that happens outside the scope of a nonprofit. This is not something that the organization would endorse. This is something that people who care about something, they go out and they do it themselves. And so examples would be, somebody running a marathon, and for every mile that they run, they want you to donate $5. Or instead of getting presents for your birthday, you ask your friends to donate to a certain charity, like the money they would have spent on your gifts. Things like that. These are things that people do out of the kindness of their heart. Just last Saturday or 2 Saturdays ago, there was a volunteer in the pharmacy, and she was selling bracelets that she made by herself. And when asked what it was for, she said that it's to benefit Manos Juntas. So basically things like that. I mean, they're little things, but they help, and it makes us happy knowing that there are people out there who care about us. And so that's something that we're wanting to do. And so grassroots fundraising is, of course, it's raising money, but the other part of it is raising awareness. And we're throwing out ideas. These are some ideas that Tyler has thrown out. One is monthly contests among volunteers to generate donors. Say whoever brings in the most donors or brings in the most money or whatever, you get a prize. I mean, I'm not going to give you a car. We can't afford that, but just little things. It's just for fun for volunteers, but it's also that you're helping us a lot. Another one is setting little collection jars around businesses in the areas, like next to the cash register, things like that. Or if we were to have short presentations at Rotary clubs, churches, Lions clubs, things like that, just telling people about our organization. Like, remember, we're not out there to get people's money. We're trying to tell them what how great we are and what all the things that we're doing. And so we just want to let them know that. And the other idea is, a lot of you are pre-med, pre-farm, pre-nursing, and so y'all are pretty smart kids. So if you were to perhaps donate some tutoring time and the money that you would get paid, perhaps you can donate it to Manos Juntas. Those are just ideas that we're throwing out, and you can discuss it amongst yourself and see where it goes. Now, so a recap is that these are all opportunities that you can apply for. So come and contact one of us and let us know. And I'm going to end with this. This is a quote that Tyler put at the end of his emails sometimes, and I love it. It says that the young do not know enough to be prudent, and so they attempt the impossible and achieve it generation after generation. And I think this fits us very well because the majority of our staff, our volunteers, are basically children in the eyes of the Oklahoma City community. We are very young, but we have taken care of over 6,000 people just last year. And so I really do think that we can do a lot more if we were to work together. So these are just some ideas that we have. And so give me a call, email me. and we can figure something out if you're interested.